Hello and welcome everyone. I'm DR.SAPTARSHI coming back to you again with a very interesting session here. We're going to discuss about fever and some of the very interesting organopathics which you can use in fever. I'm sure you know your belladonna, bryonia, rostoxin, gelsemium, eupatorium. These are all your go-to remedies for an acute case of fever. But as a soldier must know all his weapons, so a homeopath must know lots of his medicines to help in cases where you're stuck with your go-to remedies. So I'll be sharing with you a few very interesting organopathics, some of which have been used in Ayurveda for hundreds of generations, hundreds and thousands of years, and their efficacy has been verified in Ayurveda, and we have implemented in homeopathy, and I've learned these medicines as an ancestral tips to help in cases to combat acute fever, so that the patient doesn't resort to conventional medicines and conventional paracetamols. Our first remedy of the day, which we're going to share with you, is Desmodium gangeticum. You'll find these remedies in the Indian remedy section of your Borica's Metromedica, and you'll find this remedy in various other books. One of the best books to read about Indian drugs is Drugs of Hindustan by S.C. Ghosh, Dr. S.C. Ghosh, Drugs of Hindustan, and this is the name of the book. It's a wonderful book where you'll find references to Indian drugs. So you can read S.C. Ghosh, Drugs of Hindustan, you can read Indian drug section of Borica where you'll find reference to these remedies, and these are wonderful remedies which I've used in practice. The first remedy in this list, as I mentioned, is Desmodium. How and why you can use it? Remember, in Desmodium, there's a lot of pains, and the pains can be joint pains, it can be muscle pains, it can be bone pains as well in case of Desmodium gangeticum. So think of cases where you feel there are features of rustox, features of eupatorium perfoliatum, but you're confused where to go. There's a sensation in the head, that head is bound by a rope. So it feels tight as if bound by a rope, it feels tight as if bound by a tape. So that kind of bound sensation in the head as if bound by a tape or bound by a rope, you'll find in Desmodium. That's important. Again, quite close to eupatorium perfoliatum as well. The fever generally comes at 7 a.m. So that's also another important time for eupatorium, 7 a.m. aggravation of the fever. And there can be sleepiness all over. But remember of those cases where you will find pains. Pains can be in the muscle, bones, or in the joints. So you feel like sometimes it's like rostox, sometimes it's like eupatorium, but you're not sure. Think of Desmodium in those cases. With a bound sensation in the head as if bound by a tape or a rope, that's important, and a 7 a.m. aggravation. Desmodium gangeticum again has been used in Ayurveda for thousands of years under the name of Shalpani. So remember Desmodium, which has a wonderful action in such cases. You can use it in cases of typhoid fever where there are bone pains, especially in the subcontinent. You can use it in cases of meningitis, where again there can be bone pains and joint pains, as well as sensation as if head is bound by a rope. You can use it even in cases of flu, where you have the joint pains and bone pains and muscle pains with the fever. It acts wonderfully to help you counteract not only the fever, but also reduce the pains as well. You can use all of these remedies which I'm mentioning in tincture if it's available, or you can use it in 6C and 30C as well. So as and when you have the acute state, all of these are acute remedies. You can use it in the acute state, and tincture 10 drops every 6 to 8 hourly, stop when the patient improves, or you can use in 6C or 30C, again 2 globules as and when required for the fever. You can use 2 globules in water. You can repeat it every 8 or 24 hourly as the patient requires for such fever cases. Our second remedy in this list, my friends, again which has a wonderful action for cases of fever, and I've used it extensively as well, is Andrographis paniculata. It's known in the Indian subcontinent and again has been used in Ayurvedic literature for thousands of years under the common name of Kalmeg. Again, you'll find these remedies in the Indian drug section of Borica. And some of the important aspects of Andrographis, a patient is high on fever. So fever is really high, 101, 102 degree Fahrenheit. And one of the common things you'll find with Andrographis is burning. So burning in the palms, burning in the soles. So that's important for your Andrographis. Burning in the palms, burning in the soles. Burning is better by cold application. So like sulfur, burning better by cold application, that's very important for your Andrographis. Remember, it's more useful for cases of gastric fevers. So cases where patient may have a jaundice. Along with that, there is a bitter taste in the mouth tastes bitter. Along with that, there is a pain in the abdominal region, the hepatic region, it's painful. That you see the tongue is coated white. So gastric fever, where there is a bitter taste, where there is jaundice, where there is pain in the hepatic region, where there is a white coated tongue, those cases respond well with Andrographis. So think in correspondence to cases where you need Bryannia with a white coated tongue, with a gastric fever, with a bitter taste, or you need Nux vomica, and those remedies are not helping. So Bryannia and Nux vomica failing in cases of gastric fever, think in those cases of Andrographis. And the third point, which is important for Andrographis, remember it can help you in chronic fevers as well, fevers which are recurring time and again. In children especially, where either there is an enlargement of the liver, there is a derangement of the liver. In both cases, in case of Andrographis, can be really handy in such cases. The fever time is generally 8 to 10 a.m. or 10 to 12 p.m. So that's generally the time of aggravation for Andrographis. So the keynote of Andrographis or Kalmeg is burning. So fever is so high that the patient will tell you, my hands and feet burn, put some cold water in it, I'll feel better. Cases which resembles Bryannia, cases which resembles Nux vomica, with why? Because you have the bitter taste. In Bryannia you have heavily white coated tongue in gastric derangements. You have a pain in the liver region, pain in the hepatic region. And those cases where Bryannia Nux vomica is not giving you a favorable result, or you're not finding a good totality, good characteristic totality to prescribe those remedies, you can think of Andrographis in such cases. Jaundice, bitter taste, bilious symptoms, white coated tongue. And remember, chronic fevers, slow fevers, especially in children, where liver is affected. Liver is the weak link, and in those cases Andrographis can be of really help. Tincture is generally the potency, again 10 drops every 6 to 8 hours. You can use it in 6C or 30C as well. In the acute cases, repetition depends on how the patient is reacting. So I can't give you a protocol, or I can't give you a fixed ideology that you'll repeat at these intervals. But as and when the patient improves, you can gradually reduce the dosage or stop it. Third remedy in this list, which again we have had good results with and works wonderfully for cases of fever, is Tinospora Cordifolia. Tinospora Cordifolia again has been used in Ayurvedic literature for thousands of years under the name of Gulancha. So you'll find Tinospora Cordifolia again as a wonderful remedy. Remember, for cases where you have fever with UTIs, if you think of fever with urinary tract infections, where there is frequent urination, where there is burning with urination, where the patient passes small quantity at a time. So fever with UTI, where I repeat, there is frequent urination, there is small quantities at a time, and there is burning with urination, Tinospora can be of great help. But one of the most important factors to prescribe Tinospora, do always remember, is these three words. It is known as a pick-me-up remedy. So there is so much weakness, there is so much exhaustion in case of Tinospora Cordifolia, that it works wonderfully in such cases where there is fever with tremendous exhaustion. So it's known as a pick-me-up remedy. Patient is so weak that they cannot get up from the bed. So somebody has to pick them up from the bed, and Tinospora comes to your rescue to pick them up from the bed. So it's a pick-me-up remedy. It acts as a tonic to bring back the energy and to reduce the fever as well. Remember, for Tinospora Cordifolia, another very important part of its symptom picture is liver and spleen enlargement. If you see in the relationship of Cyanothus in Boricae, relationship of Cyanothus, you'll find it's mentioned in the relationship of Tinospora, a Hindu remedy for enlargement of liver and spleen with fever. So, if you come across cases of thalassemia, especially in the Indian subcontinent, cases of thalassemia, cases of leukemia, where the children's immune system is compromised, they're getting recurrent fevers, they're very weak, they're very exhausted, and at the same time there is splenic and liver enlargement as well. Tinospora is a wonderful remedy to help in all the three aspects, where you not only help to reduce the liver and splenic enlargement, where you not only reduce the recurrence of the fever, but also at the same time what you can do is help with the weakness as well. So Tinospora works wonderfully in such cases of hepatosplenomegaly with blood disorders, especially as I mentioned, thalassemia, leukemias, children with chronic anemias. Tinospora can be really of great help. And lastly, I will say for Tinospora is also you'll find a lot of palpitation. So febrile cases with palpitation, or even you come across cases where there is a recurrent fever and the patient has frequent palpitations, or sometimes due to excessive seminal emissions, patient is so weak and exhausted, there can be palpitations as well. Tinospora can be of great help in such acute cases as well. So palpitation can be due to recurrent and chronic fevers, palpitation can be due to seminal emissions as well. So the seminal emissions not only results in this palpitation, but the seminal emissions can also result in weakness as well. So it acts as a wonderful tonic, again in cases post-seminal emissions, to bring back the energy and the vital levels as well, to bring back the vitality to its normal levels. And the last aspect of Tinospora to also remember is it's a wonderful remedy for malaria as well. Cases of malaria where there is a recurrent afternoon rise of temperature. Malarial cases, afternoon rise of temperature, splenic and liver enlargement can be there in malaria as well. And at the same time, exhaustion. Pick me up, please pick me up from the bed. And that's Tinospora which will shout out to you. So remember, you can use it obviously these symptoms with fever, but I've used it Tinospora even without fever for cases of chronic fatigue syndrome, which is resulting after a lot of seminal emissions, which is resulting after recurrent malarial attacks, which is resulting post-COVID, which is resulting post-flu. To bring back the energy, Tinospora can be of real help. Palpitations post-flu, palpitations post-seminal emissions, it can help in such cases as well. Redox works wonderfully, again as I mentioned, for cases of fever with these combination of symptoms. Tincture again is beneficial. You can use in 6C and 30C as well for all of these remedies as I mentioned earlier on. The fourth one in this list, my friends, is another interesting remedy, and we call that as eagle folia. Folia means leaf, eagle is the bale plant. So the leaf of the bale plant, it's been used again in Ayurveda for thousands of years for many issues. I'll give you 3 Ds for eagle folia. What are the 3 Ds? Diarrhea, dropsy, and digestion. So diarrhea is a common area for eagle folia. So again we come back to cases of gastric fever where you have fever with diarrhea, fever with dropsy, and fever with digestion. So indigestion is the correct word. So cases of gastric fever again where the patient has flatulent colicky pains in the abdomen, cases of fever where the patient has lost appetite, no appetite, colicky pains in the abdomen, cases of fever where there is diarrhea to go along with that. Remember, eagle folia can be of great help to such cases. Eagle group, eagle marmelos, we have talked about that in our acidity session. Eagle folia both have a typical lycopodium time of aggravation. So the joint pains come after 4 p.m. and you'll find headache which comes at 4 to 8 p.m. Remember, my friends, lycopodium, helleborus all have a 4 to 8 p.m. aggravation. Colocynth, magphos have a 4 to 9 p.m. aggravation. Eagle folia, eagle marmelos also have a 4 to 8 p.m. aggravation. So the fever can come after 4 p.m. Headache can come between 4 to 8. Limb pain, joint pains can come at 4 p.m. as well. And remember the 3 Ds, diarrhea, gastric fevers with low appetite, with flatulent colicky pains, all work wonderfully for eagle folia. And dropsy is one of the very important areas for eagle folia. How that dropsy can occur? The dropsy can occur obviously with gastric disorders, and this dropsy can occur with heart disorders as well. and this dropsy can occur due to urinary malfunctions, urinary dysfunction as well. So the dropsy can be of gastric origin, cardiac origin, or urinary origin. When you have the dropsy of urinary origin for eagle folia, the quantity of urine is diminished. You understand, quite naturally, as there is water retention, the urine quantity is diminished. Now many times the dropsy can be of heart origin, and here you have to understand the comparative metromedica. Digitalis can also have dropsy of heart cardiac origin, but in case of digitalis the pulse is irregular, intermittent, every third, fifth and seventh beat is missing. Whereas in case of eagle folia, the heart or the pulse is full, strong, regular. So the pulse or the heart rate is irregular, intermittent for digitalis, but in case of eagle folia, it's full, regular and strong. Although both the remedies have dropsy of cardiac origin. So understand the comparative metromedica even if you are prescribing for cases of dropsy. Remember, as I have mentioned to you, these remedies have been used in Ayurvedic literature, and Dr. S.C. Ghosh gives a wonderful comparison on how it has been used in Ayurveda. He mentions that people used to put leaves of the bale plant in pots of drinking water, patients who are suffering from dropsy, because that pot of drinking water used to absorb that bale leaf, and gradually the dropsy would improve. So this incorporation of Ayurvedic knowledge into homeopathic metromedicas is very important to use these remedies, and I'm sharing with you only those remedies which have myself verified, which have been verified by my forefathers as well. So eagle folia, it's a bale plant and it works wonderfully in such cases. Again, tincture 10 drops, and or you can use in 6 or 30C 2 globules generally. So that's about your eagle folia on the leaf of the bale. Next one in this list, my friends, is another wonderful remedy to help such cases of fever, and I've used it wonderfully in practice, is eucalyptus. I think I have shared with you in some session about eucalyptus and how it works marvelously for cases of cold. But remember, for cases of fever, if you haven't used eucalyptus as a practitioner, you're missing out on a very wonderful remedy. Now when you consider eucalyptus, remember the 3 areas where it can affect. First and foremost is this. So the sinus is affected. Ethmoidal, frontal sinus is affected. Nose is congested. You know how eucalyptus oil wonderfully opens the clogged up sinuses. So ethmoidal, frontal sinus is affected. The sinus is all blocked up. So fever with sinus infections, eucalyptus can work wonderfully. You go down, it affects the throat, tonsils, ulcerated sore throat, inflamed sore throat, again with fever. You go down again, it affects the lungs. So respiratory infections with fever, where there is thick white expectoration, whooping cough in children, or even in the elderly, bronchitis of the old people, where they're difficult to bring out the mucus. So geriatric cases, pediatric cases where it affects the lungs and there's a lot of phlegm and they're unable to bring out the mucus in the elderly especially, or even in the children. If they bring out some mucus, it's thick white. And remember, it can work in the bronchitis of the old people, it can help in the bronchitis of children as well. So sinus, tonsils, lower respiratory infections with recurring fever. It will not only help to reduce the fever, recurrence of the fever, but also at the same time it will help in clearing up the respiratory infection as well, because it had wonderfully to clear up the mucus, not only in the sinuses but also in the lungs for eucalyptus. Also, you have to understand there are cases where there are kidney infections in eucalyptus. So if you think of the first area is sinus, if you think of the second area is tonsils, so not only inflammations of the tonsils but ulcerations, so quinsy, and the third area is lower respiratory infections. Again, as I mentioned, geriatric, pediatric both, where in elderly cases difficult to bring out the mucus, bronchitis, patient coughs and it's difficult to bring it out. In the children also, they're trying to bring it out by vomiting, and it's thick white mucus in case of eucalyptus. And lastly, remember, for cases of nephritis, kidney infections, where the urea levels, the creatinine levels are really high and there is recurrent fever with that, your eucalyptus not only helps to bring down the kidney infection, so the urea levels, creatinine levels get down in a case of renal failure, also it helps to prevent the recurrence of the fever as well. If you read Borica's Metromedica for Eucalyptus, you'll find it's mentioned continued fevers of a relapsing character, and it works as a homeopathic antiseptic in such cases to reduce the infections. Eucalyptus works marvelously. My friends, if you haven't used eucalyptus, it's a top-rated remedy to handle such acute case. And you see the spectrum of action of eucalyptus on the respiratory tract and how it can help such cases. 6 and 30 are favorable. Even you can use in tincture form as well with eucalyptus with an acute state. So that's about a wonderful, wonderful remedy, which is eucalyptus. We come to another very interesting remedy in this list is Ocimum sanctum. I'm sure many of you have heard about this remedy Ocimum sanctum, again being used in Ayurvedic literature under the common name of Tulsi. Ocimum sanctum is a superb remedy for respiratory cases. Why and how? You will find in Ocimum it's a combination of 4 great respiratory remedies. You will find in Ocimum you have symptoms of Dulcamara, so watery coryza, lacrimation from the eyes, increased secretion of all the mucous membranes. Watery coryza, lacrimation from the eyes. There's some soreness as well. You'll find in Ocimum like Dulcamara. You'll find in Ocimum so features like Dulcamara. You'll find in Ocimum there is a lot of rattling like Antim tart, lot of rattling in the lungs. It's as if the patient is going to die of his own secretion. Lot of rattling like Antim tart. You will find in Ocimum sanctum as well there is diarrhea which comes every rainy season like natrum sulph. Every rainy season there is a diarrhea, so there is a hydrogenoid taint to it. And you will find in Ocimum sanctum that there is thick yellow expectoration like Kali sulph. You see the combination of 4 great respiratory remedies. Lot of rattling like Antim tart, like the death rattle, so much mucus, so much phlegm is there. Or it's the first stage of cold. You see, what's interesting for Ocimum, it covers all the 3 stages of cold. The first stage of cold, where there is a watery discharge, what you have with Dulcamara, or there is lacrimation, increased secretion. The second stage of cold, where it's thick yellow, the watery discharge has transformed into thick yellow discharge, where Kali sulph can help. And you know Dulcamara and Kali sulph are complementary remedies, they follow each other well. And even if you consider the later stages of cold, where it almost progressed to pneumonia, where there is a lot of phlegm, where there is a lot of catarrh, it's like a death rattle, there is so much mucus, even Antim tart stages, Ocimum sanctum can help. And even on the gastrointestinal tract, there is a psychotic hydrogenoid action, where it has diarrhea in rainy season, like your natrum sulph. So, to be honest, Ocimum is a remedy for all seasons. I have myself been exposed to Ocimum as a child, and I used to, any acute cold, early stage, second stage, Ocimum sanctum can be a really, really good help in such cases. You have to understand for Ocimum there are a few other aspects as well to prescribe Ocimum sanctum. You can many times, along with these features as I mentioned, you can get soreness in the muscles, bone pains. So comes close to eupatorium, but the cold and cough has to be there with the fever and the bone pains. You have to understand the comparative Metromedica with Desmodium gangeticum. Desmodium was bone pains, joint pains, but there was no cold symptoms in Desmodium. So joint and bone pains plus cold plus fever is Ocimum sanctum. Joint and bone pains plus fever is Desmodium. So with cold symptoms, with cough, with mucus, and there is joint pains, there is soreness in the muscles, plus fever is there, that's more suited to Ocimum sanctum. Many times in Ocimum sanctum, emotionally with the acute state or intellectually they can become forgetful. So forgetfulness is the key factor for Ocimum sanctum. If you go down here, you can get a lot of mouth ulcers, aptha in Ocimum sanctum as well, which is also quite important. When you come to the respiratory symptoms of Ocimum sanctum, the dyspnea or the catarrh is worse when they're lying down. The better when they're sitting up, quite close like arsenic. When they lie down, the catarrh, the phlegm increases even more, they feel out of breath. When they sit up, they feel much, much better. So that is also quite important for Ocimum sanctum as well. So Tulsi has been used for thousands of years as a home remedy, as in Ayurvedic literature, but Ocimum sanctum in homeopathic parlance works wonderfully because you understand it can cover the first stage, second stage, even the later stages of cold. Tincture 6, 30, 200C, whatever you can find, you can work marvelously with Osmium sanctum. And the last remedy to finish up such discussion on fever is Caesalpinia. Caesalpinia bondusella, it's known as Nata. Now Caesalpinia, for cases of fever, you'll find with fever there is a headache, and the headache is generally better by pressure, generally better by wrapping up. Pressure makes them better, wrapping up makes them better. In case of Caesalpinia, you can also find there is a lot of weakness and drowsiness. The weakness and drowsiness is so much prominent that they don't like to talk, they even don't like to work at all. They just lie down in bed, they just close their eyes and they feel better. And the thirdly for Caesalpinia is a fever again is at either 8 to 10 a.m. or 2 to 4 p.m. That's the general time of fever. Now I use cases of Caesalpinia. I use Caesalpinia in cases where you'll find Gelsemium like symptoms, headache better by pressure like Gelsemium, so dull, dizzy, drowsy, cannot get up from the bed, I lie down with eyes closed, so much weakness, don't like to talk, don't like to work. Caesalpinia can work wonderfully in cases where you have features like Gelsemium. Now if you try and understand, as I shared with you earlier on, Tinospora Cordifolia is also a remedy for cases of fever with weakness. But as I shared with you, and you have to understand this in many aspects, that in Tinospora, what is the weak link? What is the weak organs? Liver, spleen are the weak organs. Urinary tract is the weak organs. So those organs are affected and you have weakness to go with that, or heart is affected, palpitations, and you have weakness to go with that, and you have fever to go with that, that augurs well for Tinospora Cordifolia. So either heart, either urinary tract, or liver and spleen is affected, plus the fever, plus the weakness, that augurs well for Tinospora Cordifolia. So the sphere of action with weakness and fever, that is Tinospora. Whereas in case of Caesalpinia, you don't have any particular sphere of action. It's just a difficult headache, which is better by pressure, and the generalized weakness and drowsiness, which you'll find with Gelsemium. And remember, for cases where Gelsemium doesn't work, Caesalpinia can come at your rescue in such cases. Again, with Caesalpinia, tincture or 6 or 30 can work well. Now, I shared with you, I think, 7 remedies for acute fever. And I'm never asking you to prescribe these remedies as a first-hand prescription. Whenever you have a good totality of a belladonna or a bryonia or a rustox or a eupatorium or a Gelsemium, definitely go ahead with that. But many times you'll find you're not getting a clear picture. Perhaps patient in today's world call you up after taking paracetamol. They have taken a few doses of paracetamol, still the fever is coming back, and do not get a clear picture in such cases, unfortunately. And in those cases, when you're not getting a clear picture, these remedies can help you. And I've tried to share with you remedies in conjunction to which you use in practice, so that you can correlate with remedies which you already know. You can use Desmodium cases where you're having features like rustox, like eupatorium, that can help you. You can use Andrographis in cases where you're prescribing like bryonia or Nux-vomica, gastric fever. Andrographis can help you. You can use Caesalpinia in cases where it's features like Gelsemium, dull, dizzy, drowsy, with a headache better by pressure. There, Caesalpinia can help you. Folia again in cases like gastric fever, where you have prescribed perhaps a pulsatilla, where you have prescribed an Nux-vomica. There, it can help you. Folia, and also Osmium sanctum, as I mentioned, first stage of cold like Osmium, second like Dulcamara, second stage like Calisol, later stages like Antimtar. Those remedies are not working, or you're not getting a clear picture of either of those, and you're confused at what to prescribe. You can prescribe in those cases easily Osmium sanctum. And Eucalyptus is a remedy just par excellence, which I cannot compare with other remedies, which I've used hundreds of times in my practice with wonderful, wonderful results. My friends, many times you have to admit and acknowledge that the world today is an impatient world. 21st century, people are very impatient. People need results from a first visit. And especially for new practitioners who are starting up, remember, you have to show results within the first or second follow-up. Otherwise, the patient won't come back to you. So in a case of acute fever, You can handle those acute fever with these remedies so that the patient doesn't resort to conventional medicines. And when you gain the confidence of the patient by prescribing these remedies, you'll always have your time, you'll buy that time to prescribe an atmio, you prescribe a tuberculinum, to prescribe a sorinum, so that the patient's recurrence is addressed. So handle those acutes with these remedies, gain the patient's confidence, and I'm sure you'll have a lineup of patients. Thank you very much for your kind attention. Long live Hanuman, long live homeopathy.